Springfield Clinic doctors kicked out of network are running out of patients with Blue Cross, and some of their waiting rooms are running low on patients who have Blue Cross.
Now, rural doctors have seen this play out before. They warn low rates could drive specialists out of business or out of town and deal a major blow to the capital city's collective health.
Who is your doctor?
Dr. Sagans.
Dr. Kenneth Sagans is what you would call a Springfield Clinic staple.
You're not feeling too well, I hear. What's going on? I mean, I've been seeing people 20, 25 years, and to sort of not be able to see them anymore and have them leave is a little bit troublesome.
He estimates a couple thousand patients are under his care.
How many are caught up in this dispute?
About, in my practice, 25%.
And when they need a specialist, Sagans says that's nearly impossible.
So having 6 to 8 month wait times now from the standpoint of any of your specialties is not uncommon. We've had that happen in the last week.
Now, how does that compare to prior to November?
Oh, yeah, it's no comparison. Before that, we could get people in within days or a week. It's almost overwhelming the system at this point. Say,
When you have a sick child, you have to get a hold of them.
Courtney Gray is a new mom. Her baby girl got sick right after Blue Cross kicked Dr. Sagans out of her insurance plan, and she tried to find a new doctor.
She got bad enough to where we just had to go to the ER because we couldn't get a hold of them, unfortunately.
Not to sound old school or anything, but losing patients and not being able to see them after you've built up relationships for so many years is, on a personal level, extremely difficult, but I think also on a professional level is bad medicine.
Bad medicine and bad for business.
Those physicians in those rural communities have been driven out.
Small-town doctors retreated to Springfield Clinic to keep their practice open. They say Blue Cross squeezed their rates so low, they had to close their doors.
But there's a huge population of people outside of the big cities that need to be taken care of, and they don't want to travel 2 and 3 hours to get their care, nor should they have to.
Stick with us. We sum up the bottom line when we come back.